The rectal examination. This is an intimate examination and you should fully introduce yourself and explain the procedure to the patient, as well as mentioning a chaperone will be present throughout. Inform the patient that it may be uncomfortable but should not be painful, and that you can stop at any time if requested. Obtain formal verbal consent before continuing to prepare and collect equipment. Gather all the equipment you need. After fully washing and drying your hands, on a trolley you will need to place gloves, lubricant and swabs, as well as disposal bags. Enter the patient area with the chaperone, confirm the patient is happy to proceed and draw curtains or close the door to maintain dignity. Put on your gloves whilst the chaperone provides support to the patient. Patient should be in the left lateral position with knees drawn up to the chest and buttocks as close as possible to the edge of the bed. Expose only the area required for the examination and perform a careful inspection of the perianal area. In order to do this, you will need to part the buttock. Note any scars, skin lesion or hemorrhoids. Lubricate the index finger of your right hand and apply some lubrication around the anus. Press pulp of the fingertip against the anal verge at 6 o'clock position and carefully insert your finger. Feel inside the rectum, which should feel smooth in all areas. Perform a full 360-degree sweep, ensuring that you check the prostate or cervix anteriorly, the sacral area and coccyx posteriorly, and the lateral walls. Note any abnormality. Ask the patient to clench as you withdraw to assess the tone of the anal sphincter. On withdrawal, check the glove tip for stool and blood. Wipe excess lubricant or stool from anus with a swab before asking the chaperone to cover the patient. Dispose of all equipment carefully as per local policy. Remove gloves first, then your apron, and dispose of all in an orange waste bag. This should all be placed in the clinical waste bins. Thoroughly decontaminate your hands before discussing findings with the patient and documenting these in the patient's notes.